So let's have a look at this, and this kind of, I see, speaks to what you were just talking about. They were talking because, of course, Little is no longer an MP. So he has the opportunity of being on the outside looking in. He was very gentle in this conversation. Like, I imagine if he was an MP, he would have been more cutting against what National has done. There was a few times he was gracious, which I wouldn't imagine he'd be if he was an MP. But they had a part of the conversation where they were talking about health, they were talking about costs, and they were talking about voluntary redundancies. Let's have a look.
This week, Te Whatu Order is seeking voluntary redundancies. When you look at the structure of the system at the moment, do you think there are too many bureaucrats relative to frontline staff?
We always thought that when you have 20 DHBs plus the various other organisations, and you got, various levels in the corporate services sector, you can probably see that there would be some surplus talent there. If you think about bringing together an IT system, so it's a national platform, it'll take a bit of time. We put a lot of money into it. Some of that's been cribbed back in this year's budget, but that was needed. Over time, there would be the opportunity to reduce those corporate roles and that corporate level. But in terms of roles that are there to support clinicians and to free clinicians up.
And this is what we've been talking about. And everyone in the health sector who's contacted us says those people who are there to support the clinicians are the reason the system continues on. Get rid of those back office jobs, and it's going to fall over. And this is about what Little's about to say.
But in terms of roles that are there to support clinicians and to free clinicians up to have more patient-facing time, I'm not quite sure what the advantage of that is, if that is indeed what is happening. So, we certainly need to have, I think, a good level of transparency to understand what is happening. If the sort of roles they want to take out of the organisation are those that actually support clinicians to provide the health care that people need, that's not going to help in the long run. It's not going to help with reducing waiting lists. It's not going to help with making the workplace or going to work each day as a clinician a lot better. So, look, they've got to work that out. But although there is some scope to take people out, it's not going to be every kind of non-clinical role is going to justify being taken out.
So there's part one, Joe. I've got about 4 little 60-second clips. You want to speak to any of that you heard?
It all absolutely makes sense to me.
Yeah. Of course. I mean, it makes sense to anyone who's sensible. Yeah. I mean, I said this last time we talked about this. We're hearing stories, and I've got to put it that way with a grain of salt, that there are specialists who are now having to fill in their own diaries and stuff. And whilst you might go, no, you can fucking fill in your own diary, it's like, $400, $500, $600 an hour specialist that the public's paying for. I don't want that person filling in their own diary. I want a receptionist, a PA, a back office person to be doing that job, so that $400, $500, $600 an hour specialist can focus only on the knees, because that's his area of speciality, not how to fill out his diary well enough. Next part of the conversation, they talk about the Māori Health Authority, which is, I guess, appropriate and stuff for the conversation today as well. So here's Andrew Little on Q&A talking Māori Health Authority.
You've lamented this government's decisions around the budget and funding for the health system. But of course, a significant change was made with Te Aka Whai Ora, the Māori Health Authority. So going back, Heather Simpson, the chair of the Health and Disability Review, upon which those reforms were modelled, opposed establishing a Māori Health Authority with full commissioning powers. Do you think that a Māori Health Authority without those powers would have had a greater likelihood of enduring through those changes in government?
No, because I don't think Māori would have accepted an organisation that was very limited in what it could do, was advisory only. And the reality is, and it's kind of goes alongside the treaty debate we're having at the moment. The reality is Māori wanted and actually need, given the health statistics that apply to Māori, to lead what is happening in the provision of health services for their people. It's a step towards tēnā rangatiratanga, and actually that is an issue, that's a principle that we have to, if we haven't already taken it seriously, have to take seriously. It doesn't compromise good governance, it doesn't compromise coherence. What it does do is acknowledge that in an area where a public system or a public service is underperforming for Māori, there is leadership within Te Ao Māori that can make a difference, but they've got to be given their head, so to speak, and be given that opportunity. And Te Aka Whai Ora was the opportunity to do that.
And now that's been taken away. There's a comment from Andrew Little coming up shortly, Chewy, where he is speaking specifically. It wasn't interesting to watch this interview as well because he's not a current MP. It's almost like Jack Tame had no reason to go after him. And Jack Tame plays a pretty straight bat. If you're green or red or pink or blue or whatever you are, pardon me. But this is no longer a lawmaker. So what you can't really go after him for decisions Labor's making today or anything. So it was a more of a kind of gentle, nuanced conversation around the issues of the day, which I found quite refreshing. We are going to talk about iwi relationships, but Chewy, any thoughts around what you heard around that? It sounds like he's basically saying for the Māori Health Authority, the way it was set up was the best way. The public health sector is not serving Māori correctly. And so that was an answer, which I think we all know, but I think that's just what he's echoing, I guess.
Yeah, again, what seems to be a very common sense thing to me, it shouldn't be controversial, that Māori were getting really poor outcomes out of the public health sector. So their need or their request was, we would like to have more control over our own health because what is going on at the moment is not working for us.
Yeah.
And to see Andrew reflect that back and going, well, yes, this as I saw it as part of our obligations under Te Tiriti is, again, I'm not a crazy person. I don't see the problem with this.
Yeah.
Like it would be like, we're rolling out a task force to tackle this underperforming thing. It's putting more funding where it's needed to get a better result, and it's just the one thing that is slightly different in this is that the people that it directly affects are asking for a bigger say or the most say in it, and again, it doesn't seem controversial to me.
Well, and it's not controversial to us because we use our common sense, Chewy. And the reason it's been deemed controversial by some is because the people group asking for this are an ethnicity. So if it was women and they were asking for an improvement in the health sector, a specialized area within the health sector, because breast cancer was terrible, and it was, the general health sector was not servicing that community well enough, and there was stats to prove that, no one would bat an eye. No one would bat an eye on a focus to this is not good enough, New Zealand. What's happening with breast cancer? It's not good. What's happening with prostate cancer? What's happening with lung cancer? Whatever, what's happening with motor neuron disease, which is what, took my mum out, is not good enough. So we're going to set up a task force, to use your word, Chewy, a special area, a special a group within the health system to attack those areas and make sure we get the stats up. Everyone would support that. And then when you say the group that needs the help is Māori, 30% of the population goes, what? No, all equal. So no. Lung cancer and motor neuron disease are individual things. They don't have to get the same treatment, right? It's very evident because of the stats we can look at that Māori and non-Māori are having different outcomes. Just like if you treated someone with motor neuron disease as if they had lung cancer, it would be a different outcome. And you'd go, maybe we need a specialist area for that other people group, which is motor neuron disease. And we're saying statistically we need a different way of working with this other people group. No, it's not a diagnosis, it's a race, but it's the same root cause that this area of society needs help because the current system is not performing for them. And when you stop and think about it that way, a group underperforming needs help. Prostate cancer, fine. Motor neuron disease, fine. Lung cancer, whatever it is. People who have only got one leg, fine. Māori, no, absolutely not. That's how we always know that this is a race baiting from the right. And as we told you last week about various former ACT and New Zealand national leaders being called racist and not looking at it, this is the reason why those characters get called racist, right? This is the reason, because all they want to see it be equal on is based on race. That's it. Chewy.
The other thought that's popped into my tiny little walnut brain just now is one of the things that the right will want to people to naturally gravitate their mind to is that if we give Māori this funding or their own health authority, like Luxon was saying, like we don't need to spin up an entire whole nother mirror image organisation for Māori, which it wasn't.
No.
That was the narrative that he wanted us to hear. He was either woefully misinformed, just reading what was on the piece of paper, or just outright lying to people. It wasn't that. But what he wants us to think of is that if they do this, it is taking away money and resources, and therefore worse outcomes for non-Māori, right?
Mm.
And that's why there's always such massive kickback against it. I will tell you right now that what has actually happened is that we have worse outcomes. We have now massively underfunded our entire health system. We have stopped new hires coming through. We're disestablishing roles. We are not replacing people. We're getting specialists to do jobs that they shouldn't be doing. We are wrecking our health system. And it's not the Māori health system that has done this to non-Māori.
Yeah.
It is our fucking government being saboteurs. I had a conversation today with a nurse who's just come back into New Zealand after being away in the NHS for 5 years. And she came back and she was like, it is better than the NHS here.
Right.
But it is very clearly going down the same path.
I might have the answer. Do you want to know the answer?
What's that?
But apparently, this national-led government wants to have everyone treated the same. So rather than improving the outcomes for Māori, what they're going to do is make it worse for everybody else. Hey, and then we're all equal and getting the same service, Chewie. So maybe their plan in all of this is to actually make the system worse, and then they can go, we made it the same for everyone. What, you made it worse? Well, you know, we can debate that, but now it's the same for everyone, which is what we always said we'd do, Chewie.
Yeah. We've God, our health system, it's just such a linchpin, right? And I would much rather have chat just pointing out that every time I make a prediction that I'm wrong and they start calling me Nostradamus. But the fact is, we have been calling this since before the election. I think if there's something that I've been wrong on, it's the sheer speed and reckless abandon that this has happened in. But I'm not wrong.
Always true. You have this gift of introducing the next item, because the next conversation for 90 seconds is they're talking about how fast the movement has been from this national-led government. That's the actual clip.
This government, it occurs to me, has moved very quickly to undo many or most of the big reforms introduced by Labour's government. How has that been for you, looking at those changes?
Yeah, I think certainly in those early months, I was stunned actually at just the stuff that was stripped out and stripped away. Now they'll say that, well, we promised to do that. It's hard not to feel there's a level of vindictiveness in some of what they've done. And it's funny, now they're talking about this massive infrastructure deficit and we really have to address it. Well, hello, we've been having that debate for some considerable time, and we had some measures in place to address that, but they stripped all of that out. They talk about lifting productivity and accepting there is a major issue about the financial implications of it, but the new Cook Strait ferries and the portside infrastructure that had to go with it was a massive productivity improvement.
Are these ferries, is this going to be, pardon the pun, the anchor that sinks this government? Are they ever going to go away? Are they ever going to be able to put that into the background and not have people pick it up to go? Speaking of dumbass, what you guys, are they ever going to be able to get away from that? I think not.
No, because I was talking about this with a mate of mine. They are going to have to replace those ferries, right?
Yep. So
that is a whole tail on the story. Every time there is a new thing announced, we'll be able to go back and go, hang on. And I would stake my reputation on this. We're going to end up with 2 ferries. Maybe they're secondhand, maybe they're new build. They'll be smaller. They'll have a lower capacity. They won't do rail. And we will end up paying more than the ferries that they cancelled.
Well, because the thing is, and this has been admitted in the House, I think it was Aisha Verrill who brought it up, maybe I could be wrong, to Nicola Willis, had to actually admit again as well that the ferries that they're looking at now is going to need new ports. So the reason they cancelled the last one was because of the ports, and that was the big runoff. They're not going to get ferries, it would appear, that will work under the current ports. So there's going to have to be new ports, or at the very least, a major amount of work done on the port. So yeah, we've been saying this since day one. We will either get like a much more expensive, well, we're gonna pay the same or more for a lesser product. That's what's going to happen. That's what's going to happen.
So small tangent. There's a fellow that came up for parole today. New Zealand's first person charged with sabotage. He was the guy that was going to take out North Island power structure.
Yeah, and the cell towers and that kind of thing, and Taupo.
Yeah.
Right.
He was targeting Transpower stuff because of vaccine mandates. Rah.
Yeah.
He did less damage to this country than our current government have.
He's a very interesting point.
Like they're saboteurs.
Hmm.
Like that's the only thing that it can come in. They are sabotaging things that we own.
Yeah.
That are for New Zealanders, so their mates can come in and make bank off it.
Yeah. That's a really interesting point, Joey. All right, we're going to keep going with this and just get the last kind of 60 seconds of talking about how fast National has moved.
Infrastructure that had to go with it was a massive productivity improvement project. We need to move freight. We need to move people between islands. We need to move freight on rail and on trucks, and we need to move people, and we need to move them in ever-growing numbers. And so there was the opportunity to do that. That's sort of gone for now. I think what also surprised me is the willingness to strip away a range of measures and policies without anything to really replace it. And it just is setting us back. If they're worried about wasteful government spending, well, when you just cancel a whole bunch of decisions and policies that have been years in the making, well, there's your several years of investment in those decisions and policies.
Yep.
Just gone up in smoke. And with nothing to replace it. And all it does is set us back. And that's the disappointing thing about it.
And just to make clarity on that, what he's saying for the two National Party people who are watching us right now, what he's saying is, they always talk about not one piece of track was laid in the Auckland train thing. It's like, yeah, that's because they had to spend like whatever it was, X amount of $100 million, getting the permits, doing the consents, making the plan. Like when you build a house and you pay, it's typically 10% you pay your architect. So you've got $100,000 house $1 million house you're going to build. You pay your architect $100,000. You haven't laid a single slab. There's nothing been done, but you've already spent $100,000. And so this government's come in and gone, look at all the money they spent. They didn't do a single thing. It's like, yeah. And when you cancelled it, that's when the money was wasted. Just like if I was going to build the house, I got the plans, I looked at them, they look beautiful. And then I stopped the process. Then I've wasted the money, not from doing that process. And that's what he's getting to there. There's another clip to come about the relationship between government and iwi. Unless there's anything you want to jump in before on that, Chewy?
No, roll it.
Roll it. I would if I could. I'm just going to find it. There we go. I'm going to roll it now. You watch me roll it. That was smooth.
As a former treaty negotiations minister, how do you assess this moment when it comes to Crown-iwi relations?
Yeah, I think we are at I think we're actually at a very serious point. I think there's a lack of understanding about the path we've been on for the last 50 years. So if you think about 1975 and the statutory recognition of the treaty, you think about 1986 and 87, we allowed inquiries into breaches of the treaty back to 1840. You think about the Court of Appeal decision, the Lands decision. You think about the treaty settlement process that sort of took off under National in the 1990s. You think about the growing economic wealth and to some degree economic sovereignty now that more and more iwi and hapu enjoy. All of those things were ultimately going to change the relationship between Māori and the Crown and Māori and the rest of New Zealand. It had to, because what was the case in 1975 was wrong. We were in massive breach of the treaty. What we're seeing is a re-establishment of the mana, of the mana of Māori, of the mana of the treaty. And as that has happened, our Pākehā actually have to make adjustments. The whole reason why we introduced Te Arawhiti, why Kelvin Davis wanted that what was then the Office of Treaty Settlements adapted to that work of Te Arawhiti, was to recognise that the bridge had been built, but Pākehā were just a bit slow crossing it. And so we had seen that.
Note that the bridge had been built and Pākehā had been slow to cross it, not Māori. Remember, when we talk about this, we talk about things like co-governance. And remember, so often when we hear it in the media by various sectors of the political spectrum, they have it backwards. Remember, co-governance is a concept that's been with us since Europeans have been in New Zealand. Co-governance was Māori saying to Europeans, you can come to the table. That's what co-governance was. And now we're being told co-governance is the Crown allowing Māori to come to the table. It's the wrong way around. So to hear Andrew Little talk about the bridge is being built, but Pākehā have been too slow to cross it, I think it's an important thing to think about, and just to have in your mindset that sometimes these things get portrayed in the media. Mainstream media may not push back on it, or David Seymour will shout it from the rooftops, and actually sometimes the absolute opposite is actually what is true and accurate and fair and appropriate, and this is one of them.
Pākehā were just a bit slow crossing it, and so we had seen that a lot of the change that happened since 1975, Māori had crossed the bridge, Pākehā less so. And so the work we were doing was to get a bit of equality in that. Once we've restored the place of the treaty, understood what the deal was, started making the changes within government and the Crown, and then understood what that relationship translates to on the ground. That's the transition we've been in. I think we're taking a step back at the moment. We'll get back on track, but we will.
Once this lot's out,
we will be a nation that truly reflects the vision of the treaty, the agreement that was made between Māori and the Crown in 1840. And hopefully by 2040 and the 200th anniversary, we will be at a place where we're all comfortable with each other, and we're comfortable with the way things are, the way we talk to each other, and that we are making this a great country together, because that's what the treaty was about.
Done.
Oh, that's a good vision.
Yeah, there you go. I've had my say during that clip, so you're welcome to yours, sir.
I just want to come back to say, he's exactly right, and I think the thing here is the reason that Pākehā have been slow to cross this bridge is because they see it transactionally. Like, what's in it for me? What's in it for us? We already have supremacy in this country. Everything that Murray seems to be bringing up, bulldoze it aside, sometimes literally. I keep coming back to something I keep hearing, which is what is good for Māori is good for Pākehā as well. It's good for all of us. Like, maybe if we did more listening, we would have more abundant fisheries, more protected areas,
cleaner rivers,
cleaner rivers. Different ideas around housing, different ideas around healthcare, different ideas around education, and maybe a better sense of self of what it is to be someone from this country in this place, rather than hundreds of years of just trying to be Little Britain of the South Pacific. And never quite measuring up to that ideal. We spent decades trying to do that, and a lot of Māori has spent a lot of time trying to fit into that structure, Winston. And a lot of them have failed this impossible standard that they should have never had to partake in. It's I got to say, when he said 2040, the 200-year anniversary, like, God, isn't that what we've talked about with left governments, right, is they think longer term.
Yeah.
And then we have an ex-leader of the Labour Party, someone that held some very powerful portfolios that needed long-term thinking, having that in the forefront of his mind. Do
Mm.
you think you have anything in the current shower of saboteurs that we have in at the moment that are thinking anything further along than, God, we've got to get back in next time?